Good morning. I'm Charles Fiegel reporting from the CAP studios in Washington, D.C. Welcome to our coverage of Day 4 of the 2025 House of Delegates and Pathologists Leadership Summit. Follow us throughout the day on social media for the latest news and updates. Joining me in the studio is CAP Governor and Vice Chair of the CAP's Council on Government and Professional Affairs, Dr. Diana Cardona. Dr. Cardona, thank you for being here.
Thank you.
Dr. Cardona, can you walk us through what our asks are going to be on Hill Day today?
Yeah, thank you for asking. So I would say there are two kind of big, broad categories that we're going to try to address today. The first one is dealing with Medicare and specifically physician payments in the Medicare system. There has not been a system in place that allows for inflation, let alone an increase in payment to physicians. This is in stark contrast to pretty much any other entity in our national healthcare system. Hospitals get an inflationary index update, pharmaceuticals, et cetera. And so really physicians have been an outlier for quite some time. So not getting an increase in payments coupled by increasing inflation at rates we haven't seen in quite some time, there is a kind of growing deficit between being able to have sustainable practices and being able to provide good care for our patients. So that's really one thing that we want Congress to help us try to address. The ways that we're proposing that we address that is to, one, let physician payments, increase with inflationary index, right? So that's the first one. The second one is this concept of budget neutrality. Again, quite unique to the physician payment system where there is just one bucket of money. And as you increase services or increase payments to one specialty, all that does is reduce it for everybody else. So this concept of budget neutrality also needs to be addressed. And so what we're asking Congress to consider is increasing that threshold from $20 million to about $53 million so that there's not as big of an impact when we do have those changes year to year. The second bucket that we're asking Congress to help us with is workforce shortages. And that's across the healthcare system, but as pathologists, we're feeling it quite intensely as well. And so along those lines, we're asking them to please reauthorize the Conrad 30 program and also to consider expanding it from not only 30 positions, but up to 35 positions. We invest a tremendous amount of money, taxpayer dollars, in training these 4 medical graduates, and yet we send them home afterwards. We should be leveraging them, and they came here, they trained here, they want to stay here, so we should allow them to stay here so that we can continue to provide care to our patients. The other areas that we're looking to address as far as the workforce shortages go is our trainees, trying to promote them to go into the rural areas. A lot of our training programs are actually in big cities, right? And so how do we encourage them to go into the rural setting? Well, you try to incentivize that, whether it's through loan forgiveness programs or through removing interest rates while they're in programs so that that's not accumulating debt while they're not really making a lot of money in training. So those are 2 additional ways that we're asking Congress to consider helping us for the workforce shortage issues.
Thank you. And do you think Congress will help us? How do you think they'll respond?
I wish I had the crystal ball to say that answer definitively, but I do think that both of those issues are bipartisan issues. They both really deal with our ability to provide sustainable, high-quality care to our patient population in our country. And I think that's something that should resonate with anybody in Congress right now. And so I know that there's this pressure to rein in costs, but I hope that they figure out a way so that it doesn't, in the long run, be detrimental to our healthcare system. So I am optimistic that we can find a solution. Will it be easy? Probably not, but I do think that both sides of the aisle will understand the importance of it.
Great, thank you, and good luck on your meetings today.
Thank you.
We'll be back with more coverage of the 2025 House of Delegates and Pathologists Leadership Summit. We will have more reports for our Hill Day on social media channels. Thank you for joining us.